Hello everyone. So today I'd like to discuss conjunctivitis with all of you all. We've seen a huge influx in patients of conjunctivitis over the past couple of weeks, and it's really spreading fast in Mumbai, and it's an extremely contagious condition. So I decided to share a few pointers today. So what is conjunctivitis? Conjunctivitis basically is an inflammation of the conjunctiva of your eye, which is basically this thin membrane that covers the white part of your eye and is also present below your eyelids. Now, when this gets infected or irritated or inflamed, or there is an allergic reaction, your eye appears completely red. It appears like a bloodshot red eye, and there will be a lot of watering, there will be a lot of irritation, a lot of foreign body sensation, in the sense you'll feel there is something there in your eye, a lot of grittiness, and constant watering in most cases, and in a few cases you will also get extreme insensitivity to light. Now, what are the types of conjunctivitis? So conjunctivitis could be either infective, wherein there could be an infection because of some bacteria or virus, or it could be an allergic. Now, you don't know which of these it is unless you go to an ophthalmologist. So my first and foremost advice to all of you all would be, if you're experiencing extreme red eyes with grittiness, watering, irritation, please go to your ophthalmologist immediately. Do not try over-the-counter medicines or any drops, because we don't know which type of conjunctivitis it is, and until then you cannot treat it. Also, most people splash water in their eyes. I would advise you not to do this because it washes away your natural tear film. So avoid splashing water in your eyes. Instead, if you're facing extreme irritation and grittiness, you can get over-the-counter lubricants that are available in all chemist shops. Just ask them for an artificial tear substitute or a lubricating eye drop, and you can use them. They are very safe. I don't really think there is harm in using them even before you go to your ophthalmologist. But that's about it. Do not use any other drops. Also, the second important thing in conjunctivitis is that how do you prevent it spreading, prevent it from spreading to others, because it is an extremely contagious condition. So once you are diagnosed, I would say keep your hands as clean as possible every time you touch your eyes. Even the caregiver who's putting drops in your eyes, or if you are putting drops in your eyes, the moment you put the drops in your eyes, go wash your hands with soap and water thoroughly. Keep a sanitizer next to you every time you touch your eyes, because of the irritation and the foreign body sensation, we inadvertently tend to touch our eyes, and that happens, and that's normal. But at least keep a bottle of sanitizer with you, so immediately sanitize your hands. Any napkin or kerchief that is used to clean your eyes, please wash it immediately. Do not just keep them lying around, because they might be touched by other people in the house, especially kids, which is the biggest problem and who are most prone to all these infections. So please wash your hands immediately. And also pillow covers, bed sheets, these should also be washed regularly. The basic point is that maintain hygiene and keep your hands clean. Every time you touch your eyes, clean them. Just follow that basic rule. Apart from that, I would say just be very careful even when you're out, when you're traveling or in a public place. If you're touching any surface or anything, just keep a sanitizer handby and avoid touching your eyes as much as possible, even when you're outside, because that is how the condition spreads. So just avoid touching your eyes and, avoid rubbing your eyes. So that's about it. I guess this is where I'd like to end it. And all I'd like to say is just be careful, be safe, and visit your ophthalmologist as soon as you experience any symptoms. Thank you.